We're live, and there we go. Hello, everybody. Thanks for joining us both this evening. If you're watching on my channel, be sure to go over to Phil. Where am I getting this from? Tell us is live. Be sure to go over to Phil's channel. There's some really good information there, some really good content. If you're watching on Phil's channel, please come over to mine. I do try to be interesting. So yeah, we're going to be taking questions live this evening. So Phil, would you like to introduce yourself to my audience?
Of course, yeah. My name is Dr. Phil Sarpong. I'm a psychologist. Oh, Darren, I don't know. I'm hearing a little bit of an echo. It may be.
Oh, okay. I wonder. Let me see. Are you hearing it from me or are you hearing it from you? Or is it just both of us?
Oh, you know what? I think I had another tab open. Okay. I think it's good. That's totally my fault.
I might have had a tab open. No, I don't. Anyway,
You're
sorry,
good.
sorry, Phil. You were introducing yourself to the viewers on my channel. So go ahead.
Yeah, my name is Dr. Phil Sarpong. I'm a psychologist. I live over here in the States in Chicago. I've been a psychologist for a few years now, but I specialize in health psychology, behavioral medicine. I have a lot of patients who come in with anxiety, depression, PTSD, but I take a unique approach in terms of integrating exercise, nutrition, and sleep, coaching as part of my therapy. So doing yoga, doing walk and talk therapy, integrating exercise. I'm really passionate about the full whole body holistic approach. So I'm really grateful to be here, Darren. Thank you for inviting me onto your channel and onto your audience.
It's great to have you here. It's good to have a different perspective, and it's also good to have someone to talk with. Something I say when I'm doing live streams is I'm the one doing all the talking. It's nice to hear another voice once in a while. But I had put it out that we were going to be taking questions live as they come in, and
Nice.
so I just put it out in the community tab if anybody has any questions in advance they might like to ask. And I got a very interesting question. When you and I had talked previously, we had talked about AI. Okay, the pros and the cons of AI. I'd started out really looking at it from a therapy perspective, and I think our conversation just evolved into a wider topic, which was good. But got a question about AI from Angela, and she was asking about AI replacing humans, feeling she doesn't really have a purpose anymore. It might take over her job and things like that. So there's maybe a lot of uncertainty around the future of AI. But something she'd mentioned as well about even looking for a husband if her mood is so low and if the future's looking so dark. And she's just wondering. The question is, what can she do about this? Now, I often say that the only advice I ever really give is not to ask me for advice. It's not very good. But I thought it was a very interesting question, that thought of maybe AI taking jobs in the future looking bleak. And I'm just wondering what your thoughts on that would be.
Yeah, first of all, I want to say I think it's definitely completely natural to feel anxious during this time about AI and automation and jobs changing. I think that's unfortunately it's going to be inevitable in terms of what AI is going to do. I do think we know at least enough about AI, and I think even in previous history and when it came to human development and technology, that I think we can pull up some really good principles to deal with this time. I know for me, and I'm not great at advice either, so I'll speak from my own personal experience in terms of what I'm trying to do right now. I think human beings bring a level of creativity, empathy, love, connection, social, just support. And human beings are also resilient, and we tend to build resiliency in times of stress. And I think one way to manage that fear is to focus on skill sets specifically that are adaptable, which may not seem like a lot because it seems like AI can already do so much. But I do think there's an aspect of a unique skill, which is emotional intelligence, which I don't know about you, Darren, but when I've played around with some of these AI models, there does seem to be a lack of emotional intelligence in some of the AI situations. I know they're continuing to kind of develop it over time, but I feel like there is this sense of human emotional connection, emotional intimacy, emotional intelligence, connection, love, compassion, generosity that are really unique human characteristics. I mean, we are human to a fault in that we take care of people and love people, even when it doesn't necessarily always seem economically the most best thing to do. There's an aspect of our behavior, our actions, when I take care of people who are, when we take care of people who are elderly or sick, people who are marginalized, people who are lonely or isolated. It's not necessarily always in the best interest to take care of people who can't take care of themselves. But as we as human beings try and think economically, socially, family, relationally, we tend to, the best love is putting others before ourselves, because we know that it's going to be a reciprocal aspect, maybe potentially, to that love. And so I do find love to be that thing, or even the skill set of emotional intelligence, to be a way that we can navigate this space. Now, how it looks, I'd want to know more about this person's strengths. I'd want to know more about their background and their experiences. But I think I do want to hopefully find that solitude in that we can do this. We can be resilient. We've gone through difficult things as a human species, and there are unique aspects to us. And so let's figure out a way to utilize those aspects for the betterment of human society.
Yeah, I would concur. If I was to put it this way, AI can be good at maybe writing reports, emails. It could maybe spot patterns and things. But what it doesn't actually have, it doesn't have things like consciousness. It doesn't really have desire. As you say, there's no emotional intelligence there. So what an AI is going to lack is the ability to make moral, ethical judgments.
Right.
An AI is also going to be able to maybe show you how to do things, work things out for you. But what you won't get from an AI is, again, take it from someone that grew up in the analog age, it's not going to be able, you're not going to be able to shadow someone and learn from them, learn from their experience, learn little ways of doing things.
Right.
The AI can maybe show you how to work things out, but it's not necessarily going to show you the human side of it. Okay, so there isn't going to be that connection there as well. The other thing I would say is, when it comes to our jobs are important, or our careers are important. At its very bare minimum, it funds a lifestyle. But we have maybe put a lot of time and effort to train to do whatever it is we're doing. But there is much more to us than what we do for a living. There is much more to us than our job title. We still matter. If it's something like finance, as Angela had suggested, I could maybe work out spreadsheets and things like that. But there is much more to us than that. There is there's more to our purpose, if you want to put it that way. More than the sum of our parts is, I guess, what I'm trying to say. There is no program, there's no algorithm that is going to replace things like courage, confidence, as you mentioned, resilience, and things like that. The AI, as much as, from what I can understand, it's a learning thing. It's constantly learning.
Right.
What it can't do is it can't actually actualize, which human beings often strive to do in many, many different ways.
100%.
So whenever we're starting to worry about the future, this is the thing about the future. There is going to be an anxiety around it, because the future is uncertain. And one of the things that fuels anxiety is uncertainty. But there is sometimes, with that uncertainty, there is this fear that whatever it is, I'm not enough. I'm not going to be able to cope with it. I'm not going to be able to deal with it. And that's when if we were to look even outside of our work and we were to look at the many different aspects of our lives, again, there is much more to it than that. That we are much more creative, as you said, Phil, much more creative. And not just that we can create art and so on. We're creative at problem solving. We're good at finding ways through things, never mind just out things, you know. We have a curiosity, which a machine doesn't have. We have a curiosity about the world, about other people, about the universe, and things like that. When it comes to, it's not just looking for a husband, it's looking for, you know, different connections with other people. You're not, as you and I talked previously, Phil, you're not going to get that from a machine. You're not going to get any kind of real connection.
Yeah.
When it comes to meeting people, the internet is useful in the sense that we'll have social media, instant connection with different people, and dating apps, you know, whether you're for them or against them, they do serve a purpose. But I believe that you meet people through other people. You meet them at social events. Something I think can help would maybe not put so much value into things like the internet, social media, AI, and things like that. Because what you don't get from social media and the computer world is you don't get to do things that you don't get to go on hiking groups, cooking classes, you know, volunteering to do different things. You don't get to go to visit art galleries, go to concerts and things like that. You could look at these things online, watch them online, but the connection isn't the same.
Yeah.
I guess what I'm trying to say is real life is really where the humans are.
Exactly. Yeah. I wanted to add on a little bit on what you touched on too, maybe from another angle. When we look at AI right now, where it is, right? So we have all these companies who have invested into AI, and they've talked about how there's going to be this sort of generative AI, or kind of alter intelligent AI that's really going to be very functionally independent. And they've dumped so much money into, you know, trying to create this technology. I think what we're starting to see is that there are some cracks in that system, in that they're promising a lot of their investors so much basically profit from their investment, but the money doesn't add up, right? So we have this economy where we're putting all this money into AI, but what happens when AI doesn't span out to what these investors hoped it would be in terms of their investment? And I think we're going to have I think it's going to be a little rocky. I don't think it's going to be smooth. I think a lot of people are like, oh, 3, 4, 5 years from now, things will change. I think that might potentially be true, but I think the AI that people are thinking is really going to kind of take over the landscape of the workforce, I think it's going to take some time. And I think in that time, we have a lot of time to figure out perhaps maybe what we want to do, build out those skill sets, have that human connection, try and add on elements of our own human-centered qualities that can kind of merge with some of the developing AI. So, you know, I think I'm looking at it from this perspective that there's still time, right? There's still time to learn and understand the future in terms of what we contribute today in terms of ourselves.
It sounds like what you're saying is reclaiming your agency.
Yes.
What comes to mind as you're saying that is if you were to maybe use the AI, use it in a way that, you know, I've tried AI and it just doesn't work for me. I just can't get my head around it. But if you were to use AI in a way that you could be asking it things like, help me, or what can I do to make my skills AI proof? So you use it to collaborate with you, not to replace you. Using it in ways to guide and advise you. And so, if you will, you're correct. You're protecting your mind, if you know what I mean. Yeah,
100%.
And even those stuff, as I said, the things you do in real life with other people, what you're doing is you're building proof that you do still matter. You are still of value.
Exactly.
Whether again, a little bit of voluntary work, mentoring someone, helping someone out with a little project, whatever it is.
Yeah.
You're proving that you still matter.
Exactly. It's something real quick too that I saw online. So when it comes to even accountants, right? People have talked about how AI could completely replace accountants because it's kind of like just plug and chug. But then there were different research articles that were saying, well, what if someone combines their degree with some type of management leadership training, perhaps in IT, either a minor or specialty, or, maybe they have an accounting degree, but they have a specialization in IT in terms of their master's, or maybe they combine it with an MBA, business degree in that case. Now they've just positioned themselves to understand AI, understand the numbers, and maybe with some type of leadership certificate, they know how to manage people or they know how to manage AI. So now you've just positioned yourself in a way where you've leveraged your skill sets and you've positioned yourself to where you're making yourself irreplaceable, because now you have all these different skill sets where it's not just about companies bringing in money. They want people who know how to manage people and people who understand the nuances of technology, that can advise them, that can consult with them, right? And so I think there's going to be opportunities for all of those things.
Yeah, and again, whenever you and I were talking about AI, one of the things that we touched upon is about the AI becoming the therapist, whereas AI could be a useful tool to use in therapy, but not necessarily become a therapist. You mentioned about using it for things like desensitization and so on. So it's using it rather than fearing it, if you know what I mean.
Exactly. Well said.
So another question that came up was about derealization, which I thought was an interesting question. The person was asking about how important is it for them to properly define reality. And this is in a world where there's so much information out there. Sometimes we don't know what's true.
Yes.
So I thought that was an interesting question. Now, derealization, and perhaps you know more about this, so you can correct me. I think it's like a dissociative symptom sometimes. It's like maybe looking at something from a distance. It's like you're observing it as opposed to going through it. Sometimes it can feel a little distorted or a little dreamlike. My understanding as well, and again, please correct me if I'm wrong, but it's like a stress response, sometimes maybe a trauma response mechanism.
Exactly.
It's often linked to things like anxiety, stress, burnout, and so on. So it's just the person, if you will, they're detaching from what they're going through, and it's a way of maybe trying to manage some kind of overload.
100%. Yeah. Okay. Yeah, I would say that's very spot on. I actually see this a lot in my clinical work, because I work with a lot of PTSD people who have either had childhood trauma, military trauma, sexual trauma. And, whenever you go through a suffering experience that completely disorients your whole world, in order for the body and the mind to cope, it sometimes dissociates, right? It's a protective mechanism and to kind of keep your mind sane. But it's a strength and a weakness in that when you're dissociating in that way, now you're dissociating from reality. And so you don't really know what's true, what's real. I don't mean to connect everything to technology, but when you were talking, it reminded me of a lot of these VR headsets, virtual reality headsets, or sometimes you have these companies like even Facebook or Meta that are kind of building out these virtual reality worlds where you can eat and sleep and build a house, and it's all technological, right? It's all in this kind of reality-based world. And I think in those situations, if someone's already has a pre-existing traumatic history, they're already dissociating, there's already a derealization, I think this can actually exacerbate that, because the whole concept of derealization is it's a separation, like you mentioned, from attachment. And so one of the things that I've done with my patients is we want to ground you to reality. We want to anchor you to what's real. We want to look at your sensory items, things that you can touch, things you can hear, things you can see, things that you can feel, things that your brain can immediately connect with in terms of reality. I usually advise people to not, who have maybe some of these conditions, to not go on social media, to not go on virtual reality, to actually kind of stay away or steer away from the virtual reality world, and to actually embed yourself into nature, take walks, run, ground yourself to the
Touch what's
ground,
real.
nature. Yes, to what's actually real, the sunshine, if you live by the ocean or the lake or whatever, the natural elements are so incredibly important. And then a really good social support system of people that you trust can help rebuild that attachment over time, to help that sensory experience.
Yeah, I would say there is a lot of information out there, and we are going to get these days. Everybody has an opinion. What you're going to get are a lot of different opinions. And I remember back when I was a student, we were given the example that 10 people could see the same car accident. You're going to get 10 different versions of what happened.
Yeah.
And sometimes what's going on with us, I think, is the versions that I'm getting aren't fitting what I'm actually seeing.
Oh, yeah.
And that could well be true. That could well be true. But if I put it to you this way, I think it was Carl Rogers. I believe it was Carl Rogers. He had said that we don't just necessarily respond to things that happen, to events, to objective things. It's more about how we respond to how those events register with us, what they mean to us.
Yes.
So what we have to remember is, if we're reading other people, doesn't matter whether it's a news outlet or it doesn't matter whether it's just somebody's opinion on something, they're doing exactly the same thing. So that's something worth bearing in mind when it comes to the news. Again, that's a difficult one. There are people out there say watch as many different news sources as possible, because you're probably going to get the truth somewhere in between all of it. There is the danger we can become overwhelmed, but I think it's just opening ourselves up to the possibility. First of all, there could be a different perspective, that other people are maybe entitled to their opinions, even if we don't agree with them, if we don't believe them, or whatever. But it's recognizing that it's not necessarily what actually happens. It's more about how it sits with us internally, how we're maybe interpreting it. And what comes to mind is, I spoke about this probably about 2 or 3 years ago by now. I talked through this on a live stream. It reminds me of Ellis. He came up with the ABC model, the A being an activating event, what happens, the B being the belief. What do you believe happened? What do you believe about yourself, the situation, the world around you? And the C is the consequence of the belief. So it's little things like that are good to help us not necessarily prove ourselves wrong, but to either help us reframe something, or to help us explore for other alternatives, maybe a reasonable alternative if it's something that's causing us a lot of distress, or even just to recognize the narrative that we're creating around it. It's a very useful little formula, I believe.
Oh, I love what you're mentioning, because I think it speaks to the human flaw of bias, in that, there's our truth, there's the other person's truth, and then there's like the reality. And what's fascinating, I think it's fascinating when you, even on social media or on the news, they'll play a video, or they'll play a scene, or they'll present something that happened, and we all see the same thing. We all see the same video. We all see the same characters at play. But then you still have 10 different perspectives on what happened, right? Sometimes even in human beings, even in the reality of the video evidence of something that happened, you can still have this bias. You can still have this, well, what about this? Or what about this? What about this situation? And I think it goes back to the flaw of the human brain, and that, there's so many studies that have showed that if you prime someone on, black cars, the next time you keep saying black card. Maybe for the next week, now you're going to start noticing black cars, and you're like, oh wow, there's all these black cars, but they've always been there. It's just that now your brain is
You're much more aware.
You're more aware of it.
Yeah, I think that whenever we do feel some kind of discomfort about what we're saying, I don't think there's necessarily anything wrong with us. I think what could happen is it's touching something important to us.
Mm-hmm.
It's something that means a lot to us. I think another thing to think of is if it is causing us some kind of discomfort, it could be that whatever it is we're being told, maybe we're just not willing to lie to ourselves in order to just feel comfortable, in order to be able to fit in. So there could be a lot of different things going on.
Oh yeah. Yeah, that's so true. That's so true. I've had so many of my patients where they come into therapy, and not that they're playing like a victim role or anything like that, but something's happened to them, something that's really devastating, something that's really hard. And they go from a state of it's all that person's fault. 100% of it is their fault. And then as we walk through therapy and we're asking questions and we're looking at different perspectives and alternate viewpoints, they move towards the sessions and they start to realize, you know what? I have a part to play in this as well. It's not 100% that person's fault. And they start to, I think of it as they're viewing the situation now from above, from a 100-foot viewpoint, rather than when you're in the situation, almost like a maze. You see this level, you see this level, and you can only see your perspective. But if you rise above it, you start to see all of the different aspects that now have impacted your direct perspective.
Yeah. I liken it to, it's like we're looking through a tube. All you can see is what's at the end of the tube. Like, even if you move the tube about, you might see other things, but you can't really make sense of what you're seeing.
Yeah.
Going to therapy, things like that, having someone work with you, it's a way of gently taking the tube away. And the very thing they're looking at is still there. It hasn't went away, but they now see it in a different context.
Yes.
So they can see the bigger picture. They can see cause effect. They can see rhyme and reason. They can see options, choices. They can see resources. They can see supports. They can see a lot of different things.
100%.
Trying to get the tube away in the first place. And I think that I've said this many times, and I know I'm going out on a limb, and it sounds like I'm being judgmental, but not necessarily in a bad way. But I think this is true. If a lot of people watching my channel, you've been in very difficult situations, relationships, things like that, with very controlling, manipulative people. The number of times I've said there is no shame in having been lied to. And there is no shame in having believed the lie, because they were very, very good snake oil salesmen. No shame in it. Oh, I've lost you. Where'd you go?
Sorry. Am I back? Sorry about that.
Yes, you're back now.
Okay, there we go. What happened with my camera?
My abandonment issues came up there. I've got a question from Jane, which is, again, it's another very interesting question. Thank you, Jane. She's talking about memory loss after trauma, and this is even after you're maybe out of the situation, after the trauma has ended. The question is about losing the good memories but keeping the bad ones, and wondering how does she get those memories back. And I think that I think it's an interesting question. I would say that when it comes after the trauma, when you think about post-traumatic stress, post-meaning afterwards, when we're in a situation that is very deeply distressing and traumatic, what we have to remember is we're putting every bit of effort we have into just functioning and getting through it. The part of our brain, and this is, I go way out of my depth here, the part of our brain that is hardwired to recognize danger is in overdrive. So we're flooded with cortisol and things like that. The other part of our brain, the part of our brain that stores memories and things like that, it's not working the way it should because we're constantly in survival mode. So that can be one of the reasons. What do you think, Phil?
Oh, this is a fascinating question. It's interesting how trauma impacts memory. Like you mentioned, it impacts our memory system, specifically the hippocampus, which is responsible for kind of building.
That was the word. Thank you.
And that's what I'm here for. And it's fascinating because I think when it comes to trauma, either I've had patients where they remember the bad and they forget the good, or they forget the bad, like the really deep stuff, and they can remember some good parts, which is interesting too. I think either part, your brain is in a sense trying to protect you, right? It's still that protective mechanism of helping you to either cope. If you remember all the bad, that's where we see the hypervigilance. We see people looking over their shoulder. It's hard for them to build relationships, keep healthy relationships, attachment. But if they don't remember anything about the core negative aspects of the memory, that can also be difficult because, human beings, we love stories. We love the beginning, the middle, and the end. That's why we love books. That's why we love movies. We love happy endings. We love, even when a season finale ends, it feels good to watch the season finale because it's like it's closing this chapter of our lives, right? And so we see things from a story. And so when trauma disrupts the story in our life, we can feel like we're stuck in a certain chapter. We can feel like previous chapters of our lives aren't really fully written out. And this then prevents us from then moving forward into our future, into the next chapter of our lives, right? When things are unwritten in the past, how do we move forward from really telling and living out our full story today? And so I see a lot of different types of treatments. I think we've talked about EMDR, eye movement desensitization, reprocessing, how I see it very much as, we're processing the past in the present in order to move forward into the future. And trauma has a trauma processing or trauma treatment has a way of bringing up those old memories. And anytime it does, I tell patients, you might start to have more nightmares than normal now that we've started treatment. You might start to have more intrusive thoughts. You might start to have more memories that come up because now we're confronting some of these demons that have been buried for a very, very long time. I just want you to stick with it because oftentimes, I don't know about you, I'll see patients where we start to deal into the trauma and they get to a heightened state and then they don't come back to see me because they're fearful. They're like, this is uncomfortable. And I always say it usually gets worse before it gets better. So please, if you have more nightmares, if you have more flashbacks, if you have more memory blanks, keep coming to therapy because we're confronting something that has been buried for so long. And it's just going to take time in order to really investigate and dive into what the brain is trying to do.
It's trying to protect us from a very painful kind of cognitive dissonance, I guess, that both can be true. The person, again, in very, very difficult toxic relationships, the person who hurts you is also the person who heals you. That's one of that keeps us stuck. That keeps us we find it very hard to move on from that. There's a lot of unfinished work there. But what I would add to that is, Phil, what you're saying, if I put it to you this way, what we try to do in therapy is, first of all, to integrate the experience. We can't get rid of memories, and it's not always a good idea to try to bring them back. It's better to let maybe memories come back naturally. Maybe they do over time. There's the danger of maybe creating false memories and so on. But what we're doing is we're trying to integrate into someone's experience what happened, trying to give it some kind of meaning, not necessarily a good meaning, but trying to give it something. Working alongside that, it's trying to update someone's memory as well so that they're not stuck. Yesterday's situation is yesterday. Yesterday's breath is yesterday. Things like that. And it doesn't mean that we're not going to be triggered as we're reminded of things as we go along, even moving forward.
Mm-hmm.
But it's the difference between maybe leaping straight to 100 and going into survival mode,
Mm-hmm.
and maybe leaping to a 10 or a 20.
Yeah.
It's just a reminder. I think as well, and you can tell me what you think of this. I think as well, it's when we recognize there are two sides to something. There may have been good moments. There's been bad moments as well. It's
Yes.
like anything else, and I would do this a lot in therapy. It's trying to find the middle path.
Right.
Because if we only, for instance, if someone's maybe struggling with anxiety and so on, if we only ever look at the negative, everything that could go wrong, all of the
Yeah.
worst case scenarios, if we only ever look at our regrets, our failures, and things like that, the pain that we've been through, if we only ever look at that, then we're ignoring things like growth and resilience and resources and supports and options and choices, all of that sort of thing. If
Yeah.
we only ever look at the positive, if you want to call it that, if we only ever look at the positive, I think we're just in denial.
Yeah.
So we need to have a bit of both. It's trying to find that middle path.
100%. I think this is why I really appreciate written exposure therapy or narrative kind of processing therapy. In that, what I have a lot of my patients do is I say, okay, whatever traumatic experience that you've gone through, sometimes it's really difficult for them to talk about it.
Yeah.
Trauma also impacts areas of our brain that are responsible for speech. And so when it's difficult to talk about something that's happened in the past, you don't really know how to talk about it. Maybe sometimes writing can be that therapeutic experience to put all of the story together. And there's something therapeutically healing about just writing, because writing forces us to slow down. It forces our thoughts to kind of slow down in a way, because we think faster than we can write, right? So now it forces that hand motion to kind of align itself with how the brain is thinking. And what I've seen a lot of my patients do is now they start to understand the meaning of their trauma. Not to say that it's okay what happened to them, but they start to understand the nuances of their story. I think as human beings, it's fascinating. A story wouldn't be good without an antagonist, right? No one would read a book or watch a movie if there wasn't a villain. And what I found to be really interesting is that some of the best movies have really deep character villains, right? Sometimes the villain is more interesting than the hero, in that there's complexity to them, there's depth, you start to understand maybe why they're a villain. And I think in the same way, when you write about your trauma and you start to understand and learn about the experiences of your trauma and how that relates to you, you start to see those nuances of what happened to you, maybe potentially from a different perspective, like we talked about previously, right? And so it just pulls all of those threads together. I think then to be able to just recognize and acknowledge the past, but be hopeful about the present and the future.
Yeah. I think as well, whenever we write things down, it tends to lose its power.
That's so true.
Yeah. Writing down the things, for instance, writing down the things you're really afraid of happening, the things that are causing you a lot of distress and anxiety. You write them down in your diary on a piece of paper, whatever, fold it up, put it in your back pocket, put the little diary away, go back to it even a couple of hours later. And what you'll find is, as you're reading it back, it's lost its power. I often say, again, the sci-fi nerd, I often say, I hope as an American you get what I'm talking about. It's a very British thing. We've got a head like a TARDIS, okay? In other words, it's always bigger on the inside. But once it's out there, once we've talked about it, once we've discussed it with maybe a therapist, a good friend, someone who's close to us, someone we trust, or maybe we write it down, it tends to lose its power. And it's incredible how much power it loses once it's out there.
So true. It's so true. I love that. I love that. Thank you for bringing that up.
Got one more question I'm going to ask, and then we'll go to the audience and see what they have been asking.
Okay.
Don't think we're not ignoring you, folks. Yeah, someone had asked a really interesting question. Someone is asking about practical tips and strategies for someone who's struggling with OCD. And this thing, OCD, can be a very debilitating thing. It can be very once you get caught in that loop, it's very, very difficult to try to get out of it.
Yeah. Yeah. OCD is one of those things that I've seen some interesting characteristics of it from the perspective of like it matches on to things that sometimes are like worst fears, right? And so whether it's cleaning, whether it's spiritual rituals, whether it's any form of a ritual that then becomes sort of this obsessive.
It hijacks what's really important to you, the things that you fear. Yeah.
Exactly. And then, you know, and maybe you've talked about this with your audience, but now there's this concept of exposure and response prevention treatment that we've known about for a very long period of time that basically helps people to then address that compulsive behavior head on. And it's fascinating. Like I always go back to the concept that a lot of mental health disparities or problems, it starts with just the awareness, right? It starts with the awareness of noticing what's happening.
It's about being educated in it. Yeah, absolutely.
100%. And then it's once you've noticed it, once you're aware of it, you now put yourself in a position where you could potentially do something about it. And the practice is, okay, practicing doing something about it in a way that's healthy. And then literally like repeating that practice, tweaking it, refining it to get to a point where, you know, I'll never forget someone who experienced a long level of addiction told me as they were going through 12-step and recovery processes is that one of their sponsors, one of their mentors told them, it gets better. And I think people need to hear that.
Yeah.
Where you are today is not necessarily where you'll be tomorrow or 5 or 10 or 15, 20 years from now. What you can do today in this very moment is very meaningful to your future. And with the practice, with the refining, with working with a therapist, with working with clinicians, it does get better. It may always still be there. It probably will sort of be there. Yeah, but it gets better. And I think people need to hear that in the fact that there is that sense of hope that they can lean on to.
Yeah. I think one of the things that help is you think, I know that the obsession is the terrible thing that's going to happen. The compulsion is the thing we do, the ritual, whatever it is, to try to get rid of the fear of the terrible thing that would happen. I used to read a lot of years ago, early days of the internet, and people were doing blogs and things. I used to read this guy, really interesting guy. I haven't found him in years. I couldn't even remember his name or if he's still about, but he used to talk about his OCD, and he wasn't a clinician or anything. He was just someone who struggled with it. And some of the things that I learned that I would work with people are the things that he would say. I thought was really, really interesting. When you're caught in that loop and there's that part of you that is saying, no, I'm not doing this. This is not good for me. I'm stuck here. No, you're actually increasing your anxiety. You're making it worse. And if you were, oh, I wonder what's happening. Oh, sorry, I thought I'd lost you for a moment again.
Yeah, my camera has been acting up. I apologize.
Oh, you're okay. Again, my abandonment issues. But anyway, what he said, which I thought was really useful, was he has the compulsion to maybe check the light switch or to check the tap or whatever it was his ritual was doing. What he wasn't saying to himself is, no, I'm not going to do it. I'm not going to fight this because I was bringing up far too much distress. What he would do is like he was drawing on his own procrastination skills. He would say, I'll do it in a minute or so. I'll do it 5 minutes from now. I'm just going to sit here for 5 minutes and then I'll go and check it. He would constantly be doing. I thought it was really interesting that he wasn't even a clinician. This is from his own perspective.
Oh.
Yeah, and the other thing he would be saying to himself was he recognized that, and the way he phrased it was, OCD is not what you'd call a spectator sport. It's something you try very desperately to hide because it brings up a lot of embarrassment and things like that. You don't want people seeing you go through these rituals. You feel silly, and again, that heightens your anxiety and so on.
Yeah.
So what he would do is he would always try to make sure he was with someone. Now, this would be someone he trusted. This is someone who knows what he's going through. This would be someone who would be encouraging him and so on.
Yeah.
But that was helping to reduce the need to go back and check the door.
Wow.
So just little things like that. The last thing he said, and I thought this was maybe quite controversial, but interesting. What he used to do was he would film himself, and this was probably before we even had cameras on our phones. I'm thinking that far back, it was that long ago. But he would record himself in the kitchen or whatever it was he was doing, and then at the end of the evening, he would just watch himself. So he's watching himself perform the ritual without the energy that comes with it, because at the time there's so much energy built up around it, trying to get rid of the uncomfortable feeling. And he would just watch himself back actually performing it, but not actually feeling it. And as he was doing that, he's recognizing this must be what it looks like to other people. It makes, looking at it from the outside, it makes no sense. In that moment, it feels very, very real. If I don't do this, this awful thing will happen to this person I care about.
Yeah.
But watching it from a distance, it's really taking the edge off it. And as I say, I can't even remember the guy's name. He had a blog about maybe 20 years ago, but I learned a lot from him. That's a guy that struggled with it most of his life. And it was really, really interesting.
Oh my gosh. It's a beautiful story. I think it highlights a lot of that resiliency, right? A lot of that ability with my patients specifically. Sometimes they come in with a lot of the spiritual OCD. I don't know if you've those aspects where someone feels like they have to pray 20 times a day, and if they don't, now there's this existential force, right, that now is going to punish them. So now it's not just like this sort of individualistic thinking. Now it could be connected to their religious spiritual group that is potentially reinforcing some of those behaviors. But now there's also this existential being or divine being that they believe in that is also rooted in this disorder. And so now that gets very, very, very tricky. And so I've had to do a lot of almost kind of like spiritual deconstructing and kind of questioning. You're questioning people's worst fears, but you're allowing the brain to see those fears for what they are.
This is interesting because I've said this before, and I thought that some people agree with me, some people don't. But I think before we had a name for it, before we called it obsessive compulsive disorder because of, again, the impact it's having on our day-to-day function and so on, I believe before we called it OCD, what we called it was superstition. If I don't, now what I mean by that is this terrible thing will happen if I don't do this.
I got you. Yeah.
Just you see what I mean? No, and I know it sounds like I'm maybe devaluing it, and I really don't mean to, but
yeah,
I'm tapping into what you just said a moment ago about the religious aspect of it. If I don't do this certain thing, if I don't do it in a certain way, if I don't do it thinking the right thought, so again we get trapped in that kind of cycle.
Right. It's deep. There's I really usually oftentimes, and this is where it takes a village and it takes a group of consultations and people who I trust, where for certain of my patients I've referred them over to OCD specialists because the work that they do is so valuable, but it is there's layers to it. There's so many layers to it.
Yeah, it's what I say to people as well is we all have little traits. We all like things to be in certain ways. Even, which way around is the toilet paper hang, when you put it on the wall. We all have little things that are going to give us irritation if they aren't quite the way we like them.
100%.
And sometimes there's going to be things that are going to be heightened in some people.
Yes.
I happen to like my coffee in a certain way first thing in the morning. If I don't get it, I feel like the day's ruined. We all have little things like that, and we all have obsessive compulsive traits to some degree. The disorder, the key word in these things is disorder. It is the impact that has on someone's day-to-day functioning. It's having a huge impact. And not just on their day-to-day functioning, even their work, their relationships, people like that around them. Okay, so and it can be, and you're right, OCD can be very debilitating. There's so many layers to it. There isn't even one kind of OCD. It can manifest in many different ways.
That's exactly it. I think that's where I'm like, wow, there's an OCD for almost anything that you can imagine, because if someone has a certain characteristic or behavior, that is going to then be the trait or the characteristic that you'll have to focus on. And then I think it has those overlapping effects to some of the mental health, anxiety disorders. I've seen how OCD can also get connected to like hair pulling and skin picking and things like that. So now it starts to touch into what you would see as behavioral things that are like, okay, is this anxiety? Is this, and now it starts to overlap in other different mental health kind of diagnoses.
Yeah. Oh, anyway, let's have a look at the audience. I'm curious, Phil, can you see questions where you are?
I am not able to.
Oh, okay. Right, okay, so I'm going to have a look because I'm aware of the time, but let's have a look at some of questions.
Actually, I am able to see it. Okay, there we go. Wow, we have a lot of comments.
Okay, cool. Yeah, we have a lot of comments. That's really cool. Thank you, everyone, for joining us this evening. So let me see. I have a question here. Can I do this? It's the first time I've done this, so if this works. And it does. There we go. Question is, avoidance can offer a sort of protection. Well, I would, first of all, I would say, I guess it depends on what we're avoiding. There are some things that really, truly are in our best interest to avoid. But then there are other things. I believe that sometimes the very things we do to avoid something uncomfortable can be the very things that either make it worse or at the very least just keep it going.
100%. Yeah. It's kind of like, what are they running away from and what are they running to? Because oftentimes it's not just avoidance, it's avoidance, but someone's running towards something too, and that something could be good or bad, right? So there's needs to be a lot more context to what that avoidance actually is. But I always look at even specifically addiction disorders where it's like they're running away from something and then they're running to maybe their drug of choice, right? And so that is an aspect of avoidance. So what people are running to, I think, is also an important question.
It's a very good question. That is, as I often say, that's looking at it the opposite way around, which can sometimes help us make a little more sense.
Yeah, exactly.
Sometimes, for instance, we might be, as much as we want to be accepted, what we're trying to do is we're trying to avoid someone's rejection, which is fair enough because we are social creatures. But depending on the person, the situation, and things like that, I often ask, well, look at the caliber of the people you want to accept you. Are they prepared to accept you for who you really are? Are they just mean and nasty and it's just you don't want them to be horrible to you? Have a look at the caliber of the people that you want to accept you.
Yeah, absolutely. Yeah.
Oh, let me see. I'm going to bring up a question here from Angela. It's Angela, you asked the first question we asked about AI, answered about AI.
Oh, cool.
What does it mean when a relationship expert doesn't want to talk about his wife and he doesn't want to show pictures of her? Is he a covert narcissist? Not necessarily. He could just be private, perhaps.
Yeah. Yeah, absolutely. I would agree. I'd be curious. Again, I know so much. It's funny. People hate on therapists or psychologists because I feel like a lot of times we say it depends.
Yeah. Let me, okay. If I put it this way, it's never a one-size-fits-all answer. There's never one
100%.
thing that's going to cover everybody.
100%. Yes. Yeah.
Could be that he's private, and he could be private for a lot of different reasons. It could be private because maybe his wife doesn't want him talking about her to people. It could be private because maybe there are difficulties in his own relationship. So it could be anything. There isn't really a one-size-fits-all answer.
Yeah. And there's a lot of training models that, like even in graduate school, some models talk about how the therapist should never talk about themselves, should never self-disclose. And I've seen some nuances to some of those models where it's okay, in a therapeutic way. Sometimes it could be therapeutically intentional and productive to self-disclose. But also there's a sense of autonomy that the therapist has too, in that they can choose, right? And so I know those reasons aren't always necessarily discussed to patients, but I think this might even be an opportunity for a patient to say, so I'm noticed a few things. Could you tell me why you do certain things? And I think any therapist would be happy to explain why they do certain things in a therapeutic setting, because that in itself could be therapeutic.
Yeah. I'd say as well. I mean, sometimes I would say this to myself as much as any other therapist about any other therapist. If you say to your therapist, if you're not sure why they're asking you a particular question or trying to explore a certain thing with you, just ask them and they'll explain. If they are doing something and you're not finding it that helpful, say to them. They won't be offended. Well, I know I certainly wouldn't. They're not going to be offended because what they're doing is they're trying to help you. And so what they might do is they might explain to you why they think this would be useful for you.
Exactly.
Yeah, if you think of your relationship with your therapist, it's a two-way thing. There's a minimum of two of you in it, so it's two of you that's going to have to make it work. Okay.
Exactly.
Yeah, bring things up. And as far as disclosure goes, it's not often I would do it, and it really depends on the client, but sometimes I would. But there's always a context. It's not, hey, do you think that's bad? Would you hear this? Or do you want to hear something really interesting about me? No, it's I might disclose something like a similar situation. When I was younger, I worked in this place, and I'm only really using it as maybe an analogy or to show something. It's not necessarily because I think I'm interesting and you're going to be entertained. There's a purpose behind it. Other times, and it's really, I think you're right, Phil. Tap in something that you said initially. It's maybe a judgment call. Is it going to be helpful? Is it going to be useful?
Yeah.
It's understanding your own motives if you're going to self-disclose something.
100%. And as a patient, you may never know unless you ask the question, and at least give the opportunity for the therapist to see what they say.
Yeah. So I'll tell you what, we agreed and we are coming towards the end. I'm just wondering, Phil, are there any questions that you have seen that you want to pick up? Because I think everybody tends to be having a what do you call it? Having a conversation, and I don't like interrupting people's conversations.
A lot of good dialogue. I'm just kind of looking through. There's one that is someone said, I am afraid to talk to my family, and I in terms of doing bad things and avoiding them.
See if I can find that. It's on my list. I wonder, are we seeing the same questions? I wonder if there were questions on your channel. Okay, well, someone, what was the question? If you have it, would you read it out again, Phil, please?
Yeah, absolutely. I am afraid to talk to my family, and I doing bad things and avoiding them. How do I get out of this loop? They will do demands and humiliation if I talk to them.
Okay. It sounds like it's not a healthy relationship with your own family, but that's what it's sounding like.
Yeah.
So you're trying to avoid, for want of a better term, you're trying to avoid their unkindness.
Mm. Mm.
Is that necessarily a bad thing? To avoid someone treating you badly? Is it avoiding their company? Is it?
Oh.
If people are going to behave in a certain way, sometimes we think the onus is on us to do something, to be a better version of ourselves, to impress them, to please them, or
Yes.
whatever. If it's already in them, nothing we can do or say is going to change that.
Right.
What I would say is how someone treats you is not a reflection on you.
Mm-hmm.
It's a reflection on them.
Mm-hmm.
If it's things like unkind humor, now there's a fine line between banter
Mm-hmm.
and just unkind, no other way of putting it, unkind humor. Trying to humiliate or embarrass you. If that's what you're trying to avoid, who would me or anyone else tell you what you're doing is a bad thing?
Mm.
I think it's not about how we manage other people.
Mm-hmm.
It's how we manage ourselves. It's how we manage ourselves in other people's company. Again, not necessarily knowing the situation or the setup or what's fully going on, but it is really about how we manage ourselves. What do you think, Phil?
Yeah, this is also another dense kind of comment or question. I think what I've seen a lot from my patients is that family dynamics are tricky because there's a certain extent where you can only control yourself and what you do, and you can't control what someone else does or thinks about you. And so and then family itself can also be tricky because if you have to see them every holiday or every once in a while just based on family dynamics, right, there starts to be this uncomfortability that can turn into discomfort, that can turn into resentment and also bitterness too.
Mm.
And I think this is where hopefully there might be opportunities in a safe way, in a healthy way, to address some of these things, maybe in a clinical perspective, maybe family therapy, maybe getting another family member who is a safe place and addressing it and confronting other family members where some of that conflict is happening. And that might be an unpopular opinion. There's been a trend, I don't know if you've noticed this, Darren, where people are cutting off family members completely. And I think for certain behaviors and actions, I think that's warranted. People are allowed to do what
it
they
could
need
well
to
be the best course of action in some cases. Yeah, absolutely.
100%. People are have all of the right and autonomy to do what they need to do in terms of protecting their mental health. I do think, though, sometimes it can steer towards avoiding conflict itself, and so I wonder. And this goes back to when I think about like parallel dynamics, right, between a client and the therapist avoiding talking about a conflict, and how that might parallel a situation where the client is avoiding conflicting or uncomfortable topics with their family members. And so how do we as therapists mirror healthy dialogues of addressing conflict to people who can then take those same skill sets and tools to address conflict in their life with their boss, with their family member, with their loved ones? And so sometimes I try and paint it as opportunities to figure out, okay, let's dive into this a little bit more, because you could easily have two sides that are now avoiding the conflict, and now you're just sort of sitting in this conflict pool where no one's addressing anything.
Yeah, I think, again, it comes back to, in some situations, maybe how we handle ourselves. When it comes to boundaries, it's really looking at what's mine and what's yours. At its bare minimum.
Yes.
Okay. I'm not responsible for another person's behavior. I'm not responsible for what they think or how they feel. They're not responsible for me. I'm responsible for how I behave and how I interact and so on. There's a lot of different boundaries, but if I just sum them up like that, I think when it comes to things like conflict, yeah, unless you're just an antagonistic person, I don't think any of us truly like conflict.
Yeah.
However, what I would say is a confrontation does not have to be aggressive, where there's some kind of conflict. What we're looking for, I mean, a confrontation can open up a whole line of understanding and communication that wasn't there previously.
100%.
And it's maybe how we do it. If you're in a situation or an environment where people are continually antagonizing you, poking you with a stick, trying to get some kind of reaction, trying to provoke you somehow, when we react, if you think of it this way, whenever we react, they have control.
Yeah.
Whenever we respond, or even whether or not we choose to respond, then we have control. That's how we do that. One of the things I think is interesting, and this is always about keeping yourself safe, the last thing you want to do is provoke someone where they really fly into your rage or something. There's no telling how some people are going to react.
Right.
But one of the things I do think are useful when it comes to our boundaries, recognizing what's mine and what's yours, you get them to do their own work. You don't do it for them. You don't have to explain why it's not okay to be publicly humiliated. You ask them to explain maybe why they think it is.
Yes.
You don't explain why it's not okay for someone to just take your stuff whenever they want. You ask them to explain why they think it is okay to do it. So really, it's giving people their own work to do. We stop explaining ourselves. We stop trying to reason. We stop doing all of those things. We try to do it in a way that we're presenting maybe a version of ourselves that I wouldn't say is untouchable, but a version of ourselves that is a bit more grounded in ourselves, has a bit more faith in ourselves. It doesn't mean we're not going to feel something. It doesn't mean we're not going to feel anything, but we're a bit more in control because we are responding rather than reacting. Sometimes when it comes to family situations, we don't necessarily want to cut the family off completely, but what we might do is we might learn how to manage contact. Special occasions, weddings, birthdays, holidays, Christmas,
100%.
whatever it happens to be, whatever, maybe we do have to spend time together. I'm a big believer in, you don't always look for what's easy. You look for something that might make it slightly easier.
Exactly.
And what might make it easier is recognizing, well, I've got 2 hours of this.
Yeah.
I just get through the next 2 hours. There's a lot of different things we can do, but it's about what makes something easier as opposed to just easy. And it's how we conduct ourselves, how we handle ourselves.
One of the things I was thinking about is this kind of metaphor came to mind. When you own your own home and you invite strangers into your own home, there's this, unsaid, common language that whoever you invite into your home is going to respect your space, right? They're not going to treat your home as if it's their home. They're not going to go wherever they want because no, that's your home.
They're a guest and they will behave as a guest. Yeah.
They are a guest. And so you can invite them to your living room, you can invite them to the kitchen, you can invite them to the dining room. That's your choice. And I think in those moments, you can test the relationship, right? You can test how they behave in the living room. You can test how they behave at dinner. You can test how they behave in the kitchen. And at any point in time, right, if you feel uncomfortable, you can ask them to leave because it is your home. You live there. And, you want to protect your family. You want to protect yourself. And so I think there's a level of seeing whether or not, you can put feelers out there in terms of seeing whether or not you can trust people based on your observation of them, right? And just like any home, there's areas where you wouldn't necessarily want someone to go into your bedroom, right? Those are intimate spaces where it's either for you or your partner, right? And so there are going to be these unsaid expectations and rules and spaces that feel comfortable, most comfortable for you, but you get to put out that invitation if you want.
And you can give yourself permission to revoke that invitation.
Exactly.
If you have to.
Exactly.
One last question, and it was one that came up in the comments, and it was a question about coercive control, how some people seem to get a kick out, but they seem to enjoy it. They even get cocky about it, even if it isn't working out for them the way they hope. They still do it. Now, what I will say is that's a very sort of like it's an oddly timed question, because the video I have coming out tomorrow is actually about that. There are different reasons, and I'll just summarize them. First of all, you might find someone who has this sense of entitlement. They have this false version of themselves where they believe they're superior and the world owes them something. There are some people, and you'll commonly find this in people who they will make a lot of demands, but the more you give into them, the more you give them, the more they want. They start to take more and more. Again, different reasons for that. I believe one reason is because of maybe this internal chaos that's going on. They think getting their own way, getting their, I would say, demands rather than needs met is going to take away that chaos. Now, it might for a moment.
Right.
But because it doesn't take it away, that's when they get angry and bitter and resentful, which is why we're confused. I just gave you what you asked for. Why are you screaming at me?
Right.
So there's a lot of different stuff going on. There can also be, and this is not a nice way of putting it, but it is the reality in some situations. Sometimes they just get a sadistic pleasure out of it. They just love the other people in turmoil and distress and continually compromising and all the rest of it. They're not interested in what they're asking for. They just love to see you work for them. They love to see you do stuff for them. So there can be a lot of different reasons going on. I do go more into depth in the video that's coming out tomorrow, but I'm just wondering, Phil, what do you think?
Yeah, and narcissistic tendencies and traits are interesting in that, there's a lot of research that shows, okay, how much of this is genetic, how much of this is environmental, right? If you had a child that had either a narcissistic parent or sibling, they're going to learn those characteristics and that behavior, and they're going to learn that, oh, if I do this, if I say this, if I try this, this will get me what I want, right? And so that's engraved very early into a child's mind. And then when it's reinforced in terms of how they practice it as they get older and older, now we see, I think what's fascinating with narcissism is that they are overcompensating for insecurities. At the deep root of it, it's an insecurity. It's a fear. It's a lack of control. It's a lack of control in that, this fear that someone will realize who they really are for that insecure part of who they are.
Yeah.
Yes.
Shame-based, yeah.
Shame-based, yes. And so in order to cover up that shame, they have to exercise control over other people by gaining power, validations. It's also interesting. A lot of narcissistic personalities are incredibly successful. They're CEOs, they're owners, they're so driven to control over other people or oversee other people, and there's this superiority complex that happens. And I think, unfortunately, the brain has hijacked them in a way that basically controlling behavior becomes the goal and becomes the reward. But it's like an addiction in that, like you said, even when they assert their dominance over someone or over something, they still never really gain that pleasure, because it's just a figment of their imagination. It's just something that's actually not rooted in helping them. Oh goodness. Looks like my camera just went off. Sorry about that.
Yeah.
It's actually not just rooted in something that could actually give them what they need. And so they look for those unhealthy, harmful dynamics.
I'm wondering, as you're saying that, I'm wondering, could you put it this way? What you're looking at in a lot of cases with narcissistic people are surface level demands that they think is going to fill the real deficit that's going on. They're just surface level. Nothing's ever really going to fill that.
No.
They're not prepared to do the work. I often say that The thing with narcissism is because they're blameless, because they are faultless, because they are perfect and unique and they're entitled and so on, it doesn't matter what's going on. The problem always lies outside of them.
Yes.
So
100%.
if the problem always lies outside, then so does the solution. So
Yes.
making the demands, getting the control, isolating people, getting their every whim met, they're surface level, really. They're surface level.
100%.
So there's nothing really is going to fill that, because they can't maybe look at that part of themselves that hurts. That's going to bring up far too much vulnerability.
I think that's why look, when a narcissist decides to go to therapy, I feel like that's a miracle, because at some point in time, there's a self-awareness that, okay, something might not be wrong with me. And I think usually sometimes they go to therapy because they're like, oh, something's wrong with the world, something's wrong with this other person. And then through therapy, they start to sprinkle on those seeds of like, oh, maybe I might be contributing to this. And I respect therapists who do the work in terms of narcissistic personality disorders, because it's a long road. I mean, they're not just in therapy for 6-7 sessions. This is years of therapy in building that self-awareness for them to realize some of these unhealthy patterns. And I think, unfortunately, some pretty significant things have to happen. Like I know narcissists who, even after the divorce, even after losing the job, even after losing money, even after losing relationships, they're still rooted in their own kind of self-image and them believing that they're the victim.
They were the hard done by, yeah.
Yes, and that's scary, because it's like, how much bottom do you have to get to finally realize something might be off with me?
I think you would find someone, not just narcissistic personality disorder, but even very, very deeply ingrained, even if they're subclinical, but they're very, very strong ingrained traits. Sometimes they might go to counseling.
Yeah.
Because there is a major catastrophe, maybe. For instance, maybe their partner is about to leave them. Maybe they're about to lose their job. Maybe they're about to face the consequences of something. It doesn't matter. But one way or another, there is a huge crisis, and they will go to therapy. Now, it's not that they're not prepared to do some work. I think what can commonly happen, especially if these things are so deeply ingrained, as the crisis starts to de-escalate, so does the need for therapy. Because it's not urgent anymore, and what you find is they can default back to the way things are.
Yes. Now, Darren, I'm curious, because I'm looking at some of the comments too. I'm curious on what your take is in that, how narcissism overlaps with like sort of antisocial behaviors, so psychopathic or sociopathic behaviors as well, because I think sometimes people might confuse those definitions as like, oh, the psychopath is the one that gets pleasure in ruling over others and making others, go through pain, which I think there's a pleasure aspect for narcissism as well. But I think the deep rootedness of narcissistic personality disorder is an insecurity. It is like they are a child trying to cover up the fact that they're not the smartest in the room, that they're not the best looking, that they're not the greatest at this thing. And because of that deep rooted insecurity, they have this incredibly inflated ego to try and convince everybody that they are the smartest, the prettiest, the best, right?
I think first of all, there can be a lot of crossovers. So you will even see sometimes crossover with borderline personality. That's where you would see emotional dysregulation. That's why even the slightest thing can sometimes become massive.
Yes.
I'm not 100% sure in this, but this is how I phrase it. It makes the most sense to me. With borderline, you have this fear of abandonment. With narcissism, I believe it's more fear of rejection. So the abandonment with borderline is, you're going to abandon me, I'm unlovable, or whatever. With narcissism, you're going to reject that I am the most wonderful thing ever. So and the histrionics, are going to be histrionics there as well. That's when you get That's when you get the most outrageous illnesses you've ever heard of. You know, that's when you get the most outrageous stories of bravado and daring do and so on. So there's a lot of crossovers. When it comes to antisocial is, I believe it's like more of an umbrella term for things like psychopathy, sociopathy, things like
Right.
that. And what you see is a lot of rule-breaking behavior.
100%.
You would see a lot of kicking against social norms and things like that. But what you also see when it comes to psychopathy, you will see this callous disregard for others. So it's not just necessarily that I'm superior and I'm more important. No, there's this disregard for the well-being of others, even their safety, even their rights or whatever. So there's just disregard. They can be very callous. They can be very cruel. Also, there is no remorse for their actions.
Right.
Now,
Yes.
when it is psychopathy, you also get fearlessness. Now, I don't mean that in a good way, that they'll go out and they'll fight dragons and great white sharks and stuff like that. Not a heroic kind of fearlessness. They do not fear the consequences. They, if they end up in prison, they end up in prison. They do not fear going to prison.
No.
There are some who can be so you see low impulse control. They will act very quickly. With those that maybe have a better sense of impulse control, they might be able to rein stuff in, but only because the consequences don't suit them.
Right.
They don't want to go to prison, not because they're afraid to go to prison. It's just if they go to prison, they won't have all of this.
Exactly.
They'd rather have this. You know.
Yes.
With narcissism, it's different. With narcissism, there is a lack of empathy, but it's not no empathy.
Right.
Psychopaths are very good at mimicking emotions. Can be very predatory. I don't know if you've read her work, Phil. Dr. Karen Mitchell has done this work on dark personalities, and she's talking about persistent predatory personality. And it's a combination of all of these things. She says things like psychopathy and narcissism are more just like subtypes of what goes into the predator personality.
Yeah.
With narcissism, there is a lack of empathy, but not no empathy. What they can do is they can recognize someone's joy, someone's pain, someone's misery. They know what hurts as much as they know what pleases, which makes them very, very good at being manipulative.
Exactly.
There are those where there is this empathy deficit, where if you're struggling with something, it's not on their radar. They don't necessarily know why you're struggling because it's not happening to them, so they don't see why they should care. Sometimes, again, because of the cognitive empathy, they know you're struggling. They're getting a kick out of it. They're enjoying it, and that's where you see the sadistic side.
Yeah.
In order to have, so it is a lack of empathy, but if I put it to you this way, in order to have true emotional empathy that comes with sympathy and compassion and things like that, what that requires us to do is to tap into part of us that hurts.
Exactly.
To recognize that, to recognize someone else's pain, because we have felt pain. If it's not the same pain, we still know what pain feels like.
100%.
With narcissism, the defense mechanism kicks in, and they will not do that because it's having to touch a part of them that hurts.
Right.
And they will not do that. With psychopathy, you don't have that.
Yeah.
Because it's not there in the first place. Now, when you get psychopathy and narcissism combined, you're in for a whole heap of trouble.
Oh, yeah.
Because you have a predator. You have a predator who is callous, has no regard, does not feel regret or remorse, is very parasitical. They will, suck you dry till you're nothing more than a husk. They will use people in order to get to where they want to go. This is where we see like maybe a Machiavellian side to them.
Exactly.
It's like the end, and this is where the narcissism overlaps. The end justifies the means.
Right.
It doesn't matter. I could justify my lies to you. I can justify stealing your stuff. I can justify cheating on you. I can justify.
Right.
you're in for a whole heap of trouble when these things are combined. And sorry, go ahead.
Oh, no, go ahead. Go ahead.
No, I was going to say that previously they used to be talking about the dark triad, where you would see the narcissism, psychopathy, and the Machiavellianism. More these days they're talking about the tetrad, which includes the sadism. Now, I think here's another maybe difference to some degree.
Mm-hmm.
With narcissism, the sadistic element is going to give them joy and pleasure.
Mm-hmm.
Sadism is taking pleasure from the pain and misery of others.
Right.
And it's not just inflicting it. Sometimes it's even just seeing people struggle. It gives you a hit, gives you this excitement, this buzz.
Mm-hmm.
With psychopathy, not in all cases, but in some cases, the sadism, it will, at least they will get to feel something. Even if it's power, they will get to feel something. But in other cases, the sadism is not necessarily they're doing it to feel powerful or to get pleasure. It's just a means to an end.
100%.
I will terrify you because it gets me what I want. I need to keep you terrified, or I need to keep you in a state of uncertainty. I need to keep you in a state of instability. I need to steal your stuff. I need to do whatever I want, and I will threaten you up for the consequences if anything happens to me. That's more a means to an end.
Absolutely. Yeah, I think that's very well put. Very well said. The whole concept, it's interesting. They're talking about the DSM and kind of changing or disorienting it in a different way from a spectrum perspective rather than all of the specific behaviors. And I think it speaks to what you're talking about, is that with narcissism, it's very high on defensiveness. It's very high on self-protection. And then they lash out because of that insecurity. Whereas with the psychopathic tendencies, it's very high on aggression and overtly attacking, because there is no sense of remorse or guilt or regret. There's just power and control. And like what you mentioned, when you combine those things together, there is I feel like there's a higher degree of manipulation now, because not only are you kind of like manipulating yourself out of empathy and sorrow and sadness, but you now have the 10th degree in sensitivity to be able to try and work out using other people's empathy and using other people's weaknesses for your own strengths, for your own gain, and for your own pleasure, right? And so it becomes incredibly devastating, I would say. Darren, I'm so sorry. I've ran out of time. I will have to go. This was incredible.
This has been great. I've enjoyed chatting with you again. I've learned a lot from you. I do appreciate you coming on tonight. Everybody, if you haven't already, do please check out Phil's channel. As I said, wealth of information there, some really, really good, useful content. And we'll leave it at that, and we'll do it again sometime.
Absolutely. This is great. Thank you, everyone.
Take care, everyone. Thanks for joining us. Bye now.
Bye.